Hi, I'm student clinician Christina. What's your name?
Carol.
Nice to meet you, Carol. Today I'm just going to be going through some questions, asking you about your medical history and all of that stuff. If anything makes you uncomfortable or you have any questions, please feel free to stop and ask me. And anything we discuss will be completely confidential. Do I have your permission to proceed?
Yeah, you do.
Awesome. Love that attitude. So what brings you in today? Tell me a little bit about that.
Yeah, I have really bad stomach pain.
Really bad stomach pain. Can you point to exactly where that is?
Yeah, it's like right here.
Right there. Okay. And can you tell me when this started?
Like 5 days ago.
5 days ago. Okay. Were you doing anything out of the ordinary when it started, or?
No, I was just sitting on the couch watching a movie, eating popcorn.
Okay. All right. In the last, couple of weeks, any strange injuries or accidents that you can recall?
No way, sister.
No? Okay. And has anything like this ever happened before? No? So, you've got some pretty bad stomach pain, happened 5 days ago. Is there anything you can do that's been making it any better?
I've been taking baths and it seems to help, I think.
Hot baths, cold baths?
Hot.
Hot.
So hot.
Feeling hot.
Sweaty hot baths.
Okay, good. Awesome. Well, I'm glad that something is helping. Is there anything you do that makes it worse?
It hurts more like when I'm walking, like when I'm moving. If I'm just sitting down, it's not so bad.
Okay. So it's fine when you're in the bathtub or sitting, and when you're walking and moving around it's worse.
Yeah.
How would you describe the pain?
Like probably like throbbing and dull.
Okay, and if you were going to give it a number on a scale of 0 to 10, the 10 being the worst pain you've ever felt, what would you give it right now?
Like a 5 probably.
Okay, and when it started?
I was sitting when it started, I think, because I stood up from the movie and I felt it, but I didn't feel it sitting, so like maybe sitting was probably like a 2.
Okay. So when you were sitting down, you didn't really feel anything, and it was when you went from sitting to standing?
Yeah.
Okay. All right. And now it's a 5, so it does seem to be getting worse, you think?
I think so.
Okay. Is there a certain time of the day that it hurts more?
No, it hurts all the
It
time.
hurts all the time?
So not fun.
Yeah, that sounds terrible. I'm really sorry. So is it staying just in that area, or does it
Sometimes
feel like
it goes
travels?
like this way.
Okay, so it moves kind of across your stomach.
Yeah, one would say horizontally.
Have you seen anybody else for this? Been to the doctor or
No, I was trying to
acupuncturist?
tough it out.
Trying to tough it out?
Yeah. But I'm not tough enough to tough it out.
Oh, you are tough. You're the toughest cookie I've ever met.
Really?
Yes.
Really mean that?
I mean it.
Oh my gosh.
Let's see here. So is there any other symptoms that are bothering you? You have any headaches or
No.
anything crazy going on?
Not that I've noticed.
And how is this affecting you in your daily life? Can you like dress yourself? Can you shower? Other than the pain of like walking, is how else?
Yeah,
is it
I mean I'm
affecting you?
dressed and I did it on my own today.
Okay.
It doesn't feel great, but I get her done every time I have to.
Good for you. See, you
The
are
worst-
a tough cookie.
I told you. You had doubt in me, but I told you I was tough.
Oh, you Carol, you're a tough cookie.
It hurts mostly when I put on my shoes.
Oh, interesting. Okay.
Sometimes my socks too.
Okay. Shoes, sometimes socks. Got it. Let's see. So there's nothing like this that's ever happened with you before. What about your parents or any other family members? They have any similar issues in the
Uh-uh.
past that you know of? No? Okay. And you said you have not been to the hospital, you've not been taking any medications or anything like that?
No.
No?
No.
Okay. Can you tell me a little bit about, like whether you use alcohol or recreational drugs or?
No, I'm clean as a whistle.
Clean as a whistle?
Really, I'm like 53, and I only had one drink in my whole life.
Wow, good for you.
Yeah, I just didn't want it, you know. I tasted it one time. I don't get the hype.
Wow, that's really impressive. Good for you.
Yeah, so pretty clean cut, you know.
Awesome. So no drugs, no smoking, no.
Oh yeah, no, I chain smoke cigs.
And what kind of cigarettes do you smoke?
Whatever ones I can bum off of people on the street.
Okay, so you're bumming packs of cigarettes off of people on
Yeah.
the street. Okay.
Yeah.
How many would you say you smoke in a day?
Anywhere in between like 40 and 50.
40 and 50 cigarettes.
I'm so serious, it's such a problem.
Yeah. Yeah, that's, I mean, not ideal. We
They
might need
haven't
to
really
work on
done
that.
any good research to like prove that cigarettes are that bad, so.
You know, that's a conversation we could maybe have another time.
Okay, yeah, you're right. Let's focus on the stomach.
Yeah, let's take care of the issue at hand, and we can definitely address the smoking thing, because that's a lot of cigarettes, Carol. But
They
it's
just
okay.
taste so good.
I know, I get it. But
So good. And you know, you should sit next to Lisa at the office. I mean, seriously.
she drives you to.
She's the reason I have to bum cigarette packs off of people getting out of their cars.
So really,
Whatever.
I need to talk to Lisa too.
Yeah, I think I need a therapist.
Okay. And where do you work with Lisa? What do you do?
Do you really want
I mean, only if it's really affecting you. I mean, and your stomach pain, and
to? Yeah.
if you don't feel like it's important, you don't have to share.
Well, we do like sit in desks in the cubicle all the time.
Yeah.
But we share a cubicle.
Oh, does that
Does-
stress you out?
Well, yeah, because she's always trying to talk to me about her 27 dogs. I don't know how many there actually are, but I can't keep my name straight. And they're always shitting in her house. But she shows me pictures of how great they are. And I get confused.
Yeah, that sounds
It's
like
seriously-
a lot to deal with on a day-to-day
How do
basis.
you deal with that? I don't know how I put up with it this long. I'm trying to get her fired. I've been planting things to make sure that she gets fired.
Wow. So that's a big stressor in your life then, Lisa. And
Yeah, I think so.
Okay. All right. Okay. Well, I think we're gonna be able to help you. Looks like just kind of want to go back over what we've got going on here. You got pretty severe stomach pain that started at a 2 and now it's at a 5. It started kind of in the left lower stomach area and just kind of moves to the right.
Correct.
Okay. It gets better if you're sitting or taking a hot hot bath.
Yeah.
Uh-huh.
Hot.
Bath.
Yep.
And walking and moving around makes it worse.
Yep.
It's a throbbing, dull pain that is happening all the time.
Yep.
It's definitely getting worse. You have a little bit of a stressor with Lisa and the dog situation at
Right.
work, causing you to smoke 40 to 50 cigarettes a day.
I can't believe you're laughing.
You know, sometimes
It's okay, I laughed first.
You know, sometimes when you're uncomfortable.
Right, it's an embarrassing thing to admit. I never tell anyone. Like, nobody in my house knows.
Yeah, I don't think you need to be embarrassed.
Whatever.
We can work with you.
Yeah,
We're gonna get it all figured out.
I'm surprised I haven't turned into one gigantic cigarette. My whole body.
I don't think that's possible.
Really?
Yeah.
Oh, okay, cool. Okay. Anyway.
But we can look into that too.
Yeah, let's look into it.
Yeah, so a little bit of extra pain when bending over to put on your shoes and sometimes your socks.
Emphasis on the sometimes, because it only happened sometimes.
Okay, perfect. All right, well, I'm gonna go ahead and review this and we can go ahead and continue with your physical exam and we'll get you started with the carrots. That sound okay? Awesome. Thanks, Carol.
You're so welcome, student Clinton Christina.
Let's get some Oreos.
Let's get some Oreos.